so much, Hindi team. And now we are moving to the English session. Today is our 1846th day of continuous webinar. Thank you all the participants and faculties for coming here and sharing your knowledge. And today's our guest is Dr. SANTOSH MADHAV RANADE, and he is MD in Homeopathy and MA in History and MA in Philosophy. And he's a consulting homeopath for 17 years of experience, and he's an assistant professor and HOD in the Department of Physiology, the Homeopathic Medical College, Kolhapur. We are very glad to welcome you, sir. You can start now. You are co-host. Okay. Sir, now you are the co-host. Sorry for the delay, sir. Actually.
Okay, no problem. Hello, everyone.
We are 5 minutes late.
So, after a long time, I'm coming on this platform. And I remember when I come for the first time. Just 1 second. I'm sharing the screen. Stop sharing. Okay. Just give me 1 second. I will start sharing the screen. Okay. Okay. Share screen share.
शेअर करत कुठली पाहिजे
पहिले
पहिले कुठली
this much. Share. Okay. Am I audible to you?
Yes, yes.
Okay. So nice to meet all of you after a long time. I first time on this platform at the time of COVID. And there was an issue that people were not getting a smell. So when Dr. Dhanesh asked me to continue the lecture, I decided, okay, I'm going to tell you something about the smell or odor sensation. Now, all we had studied in physiology, the basic sensation. So I'm going to tell you in detail how the odor works in clinical medicine as well as in homeopathy. So I remember those days of COVID when the patient were not getting a smell. In fact, the many housewives in our Maharashtra, when they suspect they got a COVID, they used to visit the bathroom and they take the odor of phenyl. And if you don't able to smell the phenyl, then they go to the doctor. So in this way, housewives are very intelligent people. So they find out their own diagnostic testing. Now, human nose itself is a wonderful lab. Actually, what happened inside the nose is gas liquid chromatography. Now, from chemistry, we know there are many types of chromatography, thin paper chromatography, and all those technique. But the most advanced technique is available in our nose. So, physician can use his nose as a diagnostic tool in case of clinical practice. I remember when I was a first year student, my guru, Dr. Ravi Jadhav sir, and our dean, Dr. Rajkumar Patil sir, were discussing about the deodorant causing the suppression. So that at that time I was astonished because I was a fond of odor. I got multiple types of multiple number of deodorant with me, and I was a fond of odor, and the deodorant can cause suppression. That was the day my interest in this topic was triggered, and last 25 years of journey is continued to understand the odor. So in order to understand the odor or a diagnostic tool as an odor, it was the first described by Hippocrates or Sushruta. In Sushrut Samhita, there are many types of odors are explained. So the odor is basically a tool given to the physician. Now, odor arises from multiple things, from the breath, from the skin, from the sweat, and from the secretion. So doctor knows there's a natural gas chromatography. There are different type of odors. Now, acetone odor. Suppose the patient comes to your clinic. You are entirely unaware about the patient clinical status. But with the help of nose, you can diagnose that the patient is in a diabetic ketoacidosis. I remember my incidents when I was standing on a bus stand and my teacher from my school, Marathi teacher, I meet him on a bus stand. And when I go him close to and I make him shake hand, I immediately told him that your diabetes is uncontrolled. You got a diabetes which is uncontrolled, and right now you are in a ketoacidosis, and his sugar was 640. That was the way, if you are well trained to use your nose in your clinical practice, then you can understand that the how beautifully you can diagnose the disease. Especially diabetic ketoacidosis, the smell is of diabetic patient breathe is a little bit like a fruity or ripe banana. I know Kerala bananas are in South India. Bananas are very famous food. So almost many people are from your state might knows that odor, ripen banana. That ripen banana or a fruity odor. But one thing, if the patient oral hygiene is a poor, then there is a chance that you may miss that. Alcoholic ketoacidosis, the odor is not a fruity. If the patient is in alcoholic ketoacidosis, basically pure ethanol is don't have any odor. Your ethanol is don't have any odor. The odor from the whiskey, somebody is drunken the whiskey and you get the odor, that is odor from the fossil acids in the whiskey or from the gin. Then there is a that bean is giving the odor. So the alcoholic ketoacidosis is having, you can get an odor of alcohol, but which is not a fruity. While the odor in diabetic ketoacidosis is a fruity or like a ripen banana. Now, I will tell you that many times in clinical practice, we miss this, even especially in the ICU, because we are using the disinfectant, phenyl and etc., which itself gives an odor, which masks the odor of the patient. So in order to use your nose, you have to be very attentive and you have to go to close to your patient. Now, ammonial odor. Ammonia-like odor, it's very common. If you want to know how the ammonia smell, almost in 11th and 12th science, we had learned about the ammonia. But a nice place to know the ammonial odor is a public toilet where you can get that urinous odor. In case of renal failure or kidney failure patient, the odor is uriniferous. Breathe, get a smell of urine. Breathe, get the smell of urine, but it is little bit of fishy odor. Little bit of fishy odor because of dimethylene present in the blood, higher level of dimethylene. So the uriniferous odor to the breath is a sign of renal failure. While the hepatic failure, in case of hepatic failure, the odor is like little bit of musky. No, musk, you are using the scent musk. The musky odor, this is because of mercaptans, it's the organosulfate present in the blood of a hepatic failure because liver is not able to handle the toxins. So both have the ammonical odor. Renal failure have ammonical odor and hepatic failure have ammonical odor. But it is, you have to be little bit conscious while differentiating from the breed that if they got a fishy sting to the ammonical odor, you get a renal failure. The Kerala is very famous for the fishes. So you people are well aware about fishy odor. So any odor is having fishy odor with urinous ammonical odor. Now, many times the patient describe this odor as if the rodent, as if rotten fish, or as if mouth clover. So this rotten fish odor or if a rodent odor, you have to suspect that this could be the case of renal failure or hepatic failure. Severe breathe. Now severe, nobody like to breathe in a, but that typical odor, everybody must have to experience that. Now this odor is because of anaerobic bacterial activity. Now we know that anaerobic bacteria or gram-negative bacteria are more dangerous and more pathogenic. So you cannot miss this type of odor. If the patient's breath got this type of odor, many times there could be a periodontal abscess. Now I remember one case, there was one lady, she was having complaint of hyperacidity, GERD, and typical modality, early morning nausea, early morning acidity, and as a day progress, after 12 o'clock, her symptoms get reduced. She got multiple times gastroscopy, ultrasound, and so many things. Ultimately, they told that your acidity is because of some psychological reason, and she visited to psychiatrist. And then she come to me. Now, as an homeopath, we are trained that okay, take the modality, early morning odor, and this and that. So, but I just got some clue that I asked her to open the mouth, and I'm using that use and throw tongue depressor. Since I was a student, I'm using that tongue depressor, and I just push the tongue depressor on the gum, and the gum was actually spreading pus. Pus is coming oozing out of the gums. She was got a bad gingivitis. Now over the night, the gingivitis or that pus was swallowed by her. That was giving GERD symptom, and with the day progress, her pus secretions reduces, her acidity was reducing down. So I sent her to the dental surgeon and asked him to clean all those and get dental hygiene properly. Now the young lady asked the dentist, okay, will this reduce my GERD symptom? He said, I don't know. The lady started coming back to me. Oh, he's saying, I don't know. I said, okay, wait, clean your mouth. At least your husband will be happy. If you are not, your husband will be happy. But finally, with her dental treatment and of course with homeopathic medicine, but predominantly the oral hygiene, her GI symptoms reduces. In a similar way, abscesses, even bronchial abscess, pulmonary abscess, and even intestinal obstruction that can gives you that kind of a severe odor. Now, in intestinal obstruction, where the obstruction lies, that depends. If patient can burp up, means the intestinal obstruction is below the duodenum, then there is a possibility of you can get that breathe. Now, foul sewage-like odor, you can easily diagnose by just going close to the patient. Alcoholic breath. Alcoholic breath, ethanol is odorless. But actually, you can get, I just explain you, by the odor, you can understand the patient had drunken whiskey or wine or beer. So the odor of beer is different from the odor of wine and odor of whiskey. I really don't know, but I had smelled multiple patients. So I can now definitely tell you that what the patient is. Now in a repertory, if you suppose, the addiction of whiskey, addiction of beer, there are different type of remedies we can apply. Even though all are alcohol, still we can there also the remedies changes as per type of liquor the patient is using. Bitter almond odor. Now here I want to bring your attention. The bitter almond odor, every time when you eat an almond, some time you can get that bitter almond taste and odor in your mouth, and you cannot eat that almond. This indicates cyanide poisoning. Now, case of cyanide poisoning, the physician should be very aware. If you get that bitter almond odor, especially to the vomitus, be careful because cyanide poisoning can, if you touch the vomitus, you get affected. As well as even inhaling the odor of vomitus, the doctor or caregiver can get cyanide poisoning. So at the end of lecture, I will show you the handout or I can share on your group, Dr. Dhanesh, because you have to be careful if your odor got that cyanide poisoning odor. You should be always careful that this odor is dangerous odor, and this is dangerous for the patient as well as to the doctor, because vapors contains hydrogen cyanide, and by inhaling hydrogen cyanide gas, you also become cyanide poisoning. So dear friends, whenever you feel that bitter almond odor, be careful. Take care of first. As a doctor, we should protect our life first and then others' life. So this odor to the vomitus is a really dangerous one. Then Pseudomonas odor. Now Pseudomonas, no, you know the bacteria in second year pathology, I had studied the bacteria. The most dangerous bacteria, the physician always hate that bacteria is Pseudomonas. Now Pseudomonas odor is a sweet grape-like odor or pear drop odor, grape-like odor or sweet odor to the breath. The patient may have a Pseudomonas infection. The Pseudomonas pneumonia or superficial infection due to bacterial metabolites. Now, this odor is because of that bacterial metabolites. So, if you get that sweet but grape-like odor, this is also a sweet odor, but grape-like odor, you have to be careful that this could be a Pseudomonas infection. Then chemical and pharmaceutical breath. Since ingestion of paraldehyde, coral hydrate or solvent or chloroform, you have to be careful that these are the cases of suicide. Now, one day, one lady come to me with vomiting. She was sitting in a chair, very calmly. Even though she was in agonizing pain, the pain was not coming on her face. and her breath was giving me odor. I refer her to the hospital, and the gastroenterologist called me back because that telling that, hey, okay, she got some gastritis and this and that gastritis, and I had started the antibiotic. I immediately told him, you are missing the possibility of poisoning. That was a suicidal case. And ultimately, the clever nurse. Now, nurses are very clever people. You know, the DM post graduation, all the books are written by the nurses because they are the people who are very close. So, super specialty books are written by nurses because they are clever than doctor because they are close to the patient. So, nurse kept the patient, go to the patient and told the patient that her parent are arrested by the police. Now, tell what poison you had taken. And then the patient told what poison she had taken. So, always the breathe, the vomiting of the patient come with the vomiters. Keep up the breathing, keep up the smell of the breathe. This could be the potentially poisoning case. Odor from metabolic errors. Now, methylene defect, you get a boiled cabbage odor. Now, boiled cabbage odor, so many lady doctors are there in kitchen. The cabbage get rotten. Somebody who you visited outside and your cabbage get rotten. That is because of the metabolic error of methanoin absorption. Now, PKU or has got a musty or mousy odor. I'm going to tell you the story later when if possible, I will give you more details about that. Now, this is one nice story I'm going to tell you. He was, just 1 second. The phenylketonuria was diagnosed by a doctor called a Dr. Dr. Folling, who is a Norwegian doctor. Now, there was one lady. She was running to the pediatrician, telling that her babies, they were twin babies. They feel like they smell like mouse, and everybody was laughing her until Dr. Felling was ready to smell the baby. And Dr. Felling smelled the baby, and he found that okay, the baby are really smelling like mouse, musty or mouse-like odor. And then he started working on those, and while examining urine, he find a phenylketonuria. That was the first case diagnosis. So first case was diagnosis because of observant mother. So never underestimate mother. Her symptoms are very well. That's why Hahnemann telling the history taking, always look what the relatives are telling, and more important, what mother is telling. So there are many metabolic inborn errors of metabolism. Phenylketonuria, PKU, phenylketonuria. Then osteohouse urine disease, hop storage odor. Now this hop storage odor, how it is? In UK, there are storage houses, and they are keeping some crops in that storage houses. So somebody, if you visit the UK for your trip, visit the storehouses in UK, you can get that odor and you can use it in a clinical practice. So PKU diagnosed by Dr. Folling, the necrotizing fasciitis. Now I will tell you the story of Jackson, Dr. Jackson. The Dr. Jackson was a physician and he was on a leave. So after coming back from the leave, when he visited the hospital, he find that one patient got a CABG, coronary surgery was done in absence of the Dr. Felling. And he found that typical odor, the physician returning, he can smell entering a room that rotten fish odor. And immediately start telling that there is something wrong with this patient. And this patient got necrotizing fasciitis at the site of IV, which entire ICU team was missing because they are continuously over there. The nose get adopted and they are not able to smell that odor. But with the good Dr. Jackson's nose saved the patient's hand. Immediately the patient was shifted to the surgery, and uh, he was done all the surgeries and necrotizing fasciitis. So in a hospital, suppose the patient get the odor of necrotized that rotten fish odor. Be careful. It is because of necrotizing fasciitis. Classically, even a typhoid smell a different smell. One doctor in Mount Sinai Hospital in New York, one doctor, his name is Dr. Rennie Wieger. He was also on a leave and he come back. And when he entered into the hospital ward, he said, okay, I am the first going to treat the typhoid patient. I'm the first, I want to see the typhoid patient. So the resident say, oh, I'm really sorry, sir. The patient was passed away yesterday. How you come to know that this room was got a typhoid odor, typhoid patient? He say that the typhoid patient have odor typically freshly baked brown bread, freshly baked brown bread. Now many times we are eating the bread, and when it is a fresh, it got a typical odor. That typical odor you can smell in typhoid patient. Even the patient pass away, still you can have the odor in your room. Modern perspective. Now, the science is so great that they are preparing the artificial nodes also, that is gas chromatography and mass spectrometry testing. Now here, there are multiple attempts have been done that the immediate patient breath analysis machine called the artificial nodes, it has been some utilization in the field of exocrine pancreatic insufficiency. Exocrine pancreatic insufficiency is diagnosed by breath odor. Now, heliostasis means poor, bad odor, bad breath. It's because of poor hygiene, food, smoking, Sjogren syndrome. Rotten fish, rotten flesh odor is because of necrotizing fasciitis, necrotic tissue infection. Summary, odor have hidden diagnosis, historically yet valuable diagnostic tool, promotes holistic clinical observations. There are so many references. Okay, I'm going to show you another slide, another PPT PowerPoint. Nowadays, odor had got some different value. If you go to TV article and just किसी को भी आपने पूछा क्या चल रहा है, तो लोग बोलेंगे fog चल रहा है. That's the fog deodorant odor. Now, why this deodorant are so? Now you had seen the deodorant advertisement. One boy got some deodorant and all the girls start running behind him. What it is? What is that in that deodorant that attract the girl? That's called the pheromones. Pheromones is a typical smell. Each one has a unique, like your fingerprint. Everybody has his own unique pheromones. And male pheromones are different from female pheromones. Male pheromones attract female and female attract male. And that's why there are so many creams. Now Fair and Lovely had given a Fair and Handsome. लड़कियों वाली फेयरनेस क्रीम क्यों लगाते हो? Now मर्दों वाली फेयरनेस क्रीम मेल, because it contain male pheromones. But to your surprise, where does these companies bring these pheromones? They bring it from the pig. All the aftershave lotion, body perfumes you are using in hope that a female get attracted towards you, they are produced from the pig aldosterone. They are creating alpha aldosterone from the pig. So now think about it before using this product to impress the girls. Anyway, so what are the pheromones? A chemical messenger triggering social and behavioral responses. Sexual attraction, mating behavior. It has a territorial marking also. Mother-infant bonding is also with these pheromones. Now, newborn baby knows mother with the help of his nose, that is olfaction or odor. If you keep the newborn baby from one mother and replace it with another mother, the baby knows that this is not my mother. He can identify immediately after birth. 1 minute after birth, he start identifying his mother by pheromones. Then menstrual synchronization in female. Now, this pheromone, there are a large debate in the scientific society that human had the pheromone effect because the pheromones are absorbed not by the nose but VMS, where Jacobson organ, it is situated inside the nose, and it is taught to us for a long time that it is rudimentary in human being. It is not working in human being. That Jacobson organ or vermonasal organ, which is the receptor of pheromone, but it is proved that it is also present in human being. The girl students living in a hostel usually get synchronized menstrual cycle. Now, this is the effect of pheromones. So, olfactory epithelium can detect pheromones. Role in sexual behavior, even in human attraction. Now, there's all those perfumes and all that. These pheromones makes you attractive, interesting person. I will tell you more than knows how the human behavior, psychology works. It works by evolution. The human is the only organism. Human is the only animal on earth who kisses. When we were in a teenagers, the kissing or lip lock scene in a TV, even seeing TV was a taboo. Nowadays, it is very common, but in those days, it was a very taboo that to say lip lock scene. But what is lip lock? No animal other than human does a kissing. Now, why it evolved? It evolved because the male and female share their genetic information through saliva. Our mouth got some special receptor for saliva where they are sharing major histocompatibility antigen. Means by kissing, we are giving our genetic information to our partner and taking genetic information from partner. And why this? Because the first kiss decide whether this relation is good for the next generation or not. This person is a suitable or not for the next generation. Now, this is genetic kind of a genetic testing. So the kissing is not a simply kissing, it is a genetic testing and testing major histocompatibility antigen. You know, the cost of genetic testing is so high. But kissing is simply human behavior where there's a so what I want to bring your attention that the human behavior, human nasal organ, that your spatial senses, taste and smell, they have a chemical reasoning. Now, phenylethylene amine A called the love molecule. Now, this is the molecule because of which the human feel the romantic relationship. Everybody in their lifetime, in their teenage, in their younger age or college going group, they fall in a love. Even they have a heartbreak also. There's one famous Hindi movie called the Devdas. All this is not the human, not because of what we think, what we are, but it is because of this PEA, the love molecule. PEA is a neurotransmitter, neuromodulator. And you know, when somebody fall in love with somebody, he used to propose with the help of chocolate. Why chocolate? Because chocolate contains PEA. So by giving a chocolate, we are actually inviting with because adding the blood level of PEA. But unfortunately, chocolate does not work increase the PEA blood level because stomach acid dissolve PEA. So by giving a chocolate, you cannot impress someone. So role is associated in the romantic excitement, focus, euphoria. Then level of PEA, early stages of romantic love and false with attachment stabilizes. So the PEA is good for initial healthy honeymoon days also. The small quantity of contents in chocolate, that's why we feel chocolate. We fall in love with the chocolate because chocolate contains small amount of PEA. DHEA, dihydroepialdosterone. Now, this is the hormone of adrenal cortex. Now, this also regulates our behavior and olfactory function, modulates mood, libido, and cognitive vitality. DHEA in its sulfate is secreted in the sweat, and many contribute to individual body odor profile. So, using the deodorant, there is a DHEA is added, and this DHEA is derived from the pig. So we can say because evolutionary scientists say that the pig is our closest animal, closest relative in a form of evolution rather than monkey. We have got more genetic similarity with the pig, and by behavior we have many times behave like pig. But this is the one dihydroaldosterone, the same molecule which is present in the pig. This is related with the libido and all our olfactory functions. Now, here are some olfaction hormones, and there is research relevance how the hormones, how our olfaction works in our behavior. I will skip it that we got a less time. The physician's note might one day extend beyond the pathology to the pheromone cues. Now, why it is important? Pheromone cues, because these pheromones and are the basically neurotransmitters, and many psychiatric disorders. Many psychiatric disorders can be diagnosed as well as treated once we got the technology to understand the science of pheromones. Electronic olfaction research aim to detect the hormonal changes via breath or sweat biomarkers. Now, this is at the level of research and psychosocial mood regulation and interpersonal chemistry. Now, here I want to bring your attention that the wiseness of Hahnemann and homeopathic science. How in a further lecture of next half we are going to discuss how homeopathy look at the odor. But the psychosocial disorder, mood regulation, so this olfaction or odor plays a role in a so many variety of disorders and diseases. Now you say that okay, this is okay psychological, but what is the clinical medicine says? What does the clinical medicine says about this? Now I will show you how different diseases you can diagnose with the help of the advent of laboratory and imaging diagnostic. The first diagnostic test was some physician's notes. Physiological basis, volatile organic compounds are released through the breath, sweat, urine, wound, excretion, even stool. The homeopathy got so many rubrics. When we are coming to the rubrics, we can see that there are so many rubrics on the stool, about the stool, odor of urine. Now, VOC, volatile organic compound, have metabolic or bacterial process. Why they are volatile? Because they are by nature volatile, or other because of bacterial process. A trained physician can associate specific odor with particular disease, acting as a living biosensor. So what we are as a physician, we are living biosensors. That's why that Dr. Raining can diagnose the typhoid. The patient had passed away, but his room got his biomarkers, or that odor was present in that room. Now, those are lady physicians or lady homeopath. You are more lucky than we male homeopath, because your nose is more sensitive than our one. The lady's nose is more sensitive than our one, because our olfaction have the role. Estrogen increases your nasal sensitivity. Estrogen has a role in your nasal sensitivity. So you are a better homeopath than us, male homeopath. Female homeopaths are more better because they got a good nose. Now, fruity or acetone, diabetic ketoacidosis, acetone in breathe. You can find out that acetone in a breathe. That mousy odor, we had discussed about it, that phenylketonuria. Now, source is a phenylacetic acid. What is the source? Phenylacetic acid in phenylketonuria. Fishy odor in liver disease, or trimethylaminouria. Trimethylaminouria also gives your urine a fishy odor. Then bitter almond cyanide poisoning. So I'm going to show you the handout also, how to protect yourself in the time of cyanide poisoning. Sweet or grape-like odor, Pseudomonas infection because of bacterial vitality. Ammoniacal odor, uremia, renal failure. Now here we had already studied that how to differentiate between renal failure and hepatic failure. Then fecal odor, putrid odor, bowel obstruction or gangrene. Now gangrene is a something which you can smell also. Gangrene is something you can smell also, or other. You first understand the gangrene by smell only. Some more detail. If we go in now, poisoning cases, ingestion or poisoning, suicidal. Suppose somebody come with you with having tried attempted suicide. The sweet odor. It's a fruit like decomposing apple or acetone like. It could be ketoacidosis, but it could be chloroform poisoning, salicylate poisoning, or phenol poisoning. Now, phenol. Now, the thing which is used for a bathroom cleaning. Now, the people used to do in a suicide, but this could be the possibility. Don't always think on a ketoacidosis, diabetic ketoacidosis. This could be a phenol poisoning also. Fishy, how it describe? Fishy, rancid, bitter, boiled cabbage, boiled cabbage. It is hypermethanoemia. Hypermethanoemia. This is a metabolic disorder. Then other burned oregano or burned hemp, marijuana. Marijuana nowadays in India, these addictions are increasing. Marijuana trend is increasing. Your notes should be ready to find out the patient is under influence of marijuana. Now, if you get a camphor-like odor, this possible poisoning with eucalyptus or naphthalene ball, that deodorant you kept in a bathroom. Some people used to get them as a suicide, or eucalyptus oil. In South, I think Kerala, there are so many trees of eucalyptus. You people know eucalyptus oil. So suicidal attempt with eucalyptus oil, you get a camphor-like odor. Coal gas, no, carbon monoxide poisoning. Now here I want to bring your attention. If you any day you get a case where the person falls sick in a bathroom and bathroom got a gas geyser, then this is a case of carbon monoxide poisoning, which is very lethal poisoning. Why? Because there is nobody who get a big window on a bathroom. Bathroom is a personal place. Privacy is there. So windows are small, less oxygen. And if you fit the gas geyser in the bathroom, of course, government had printed on a gas geyser the warning that don't feed gas geyser inside the bathroom, because C plus O2 is a CO2. We had studied in a school days. But when there is a less oxygen, because bathroom is a closed place, the oxygen deplete, then C plus O is a CO, carbon monoxide. Actually, carbon monoxide is odorless and colorless. So you don't know. The patient will fall down unconscious, you get a convulsion, fall down unconscious, even died without knowing how he died. The most painless death is carbon monoxide poisoning. I had seen 19 deaths in a bathroom in last 25 years, 19 deaths, and save more than 50 people in a bathroom. They were having carbon monoxide poisoning. And one thing, if you go for the rescue, don't enter immediately inside the bathroom, that you also get carbon monoxide poisoning. It is little bit of coal-like gas is there in the carbon monoxide poisoning. Odor is associated with coal gas. So those knows the coal gas they can understand. But always be careful while going for a rescue carbon monoxide. And only thing is can save is a ventilator. Garlic odor. Garlic odor. No, garlic, the garlic is a common component of your food. It is in a yellow phosphorus poisoning or tellurium or parathion poisoning. Metallic iodine poisoning. Povidone iodine is a favorite choice of suicidal drug. That metallic odor to the breath. Rotten egg, hydrogen sulfide or mercaptans poisoning. Shoe polish. What the things people use for the suicide? What? I really don't know. Shoe polish. Now this gives nitrobenzene poisoning, shoe polish like odor, disinfectant phenol odor, hydrocarbon, various hydrocarbons, so many hydrocarbons are there used for the suicide purpose. Now disease, now forget the poisoning. Okay, I'm a homeopath. Why poison case will come to me? But disease will, okay, now there will be butcher shop odor. Butcher shop odor, it is common in yellow fever. Yellow fever is not present in India, but if you are somebody is practicing US, yellow fever is there. Butcher shop odor, you know the typical butcher shop odor. That is a characteristic of yellow fever. Freshly baked brown bread, that is related with typhoid. We had discussed the case of typhoid also. Freshly plucked feathers, rubella. Now rubella, because of vaccination, rubella is nowadays a rare disease. But still, the rubella, how they eat odor? Freshly plucked feather. Nowadays, resistant rubella is going on. So you possibly that in this season, we get some cases of rubella. Scurvy, nowadays scurvy is rare. It got a putrid odor from the breath. Miliary fever, rotten straw. Straw that farmers knows that rotten straw odor. Then that's the miliary fever, miliary rash, miliary fever. Our maternal is rich in all this type of repertory and maternal rich in this kind of odors. Pellagra, once a deadly disease. In Marathi, there is one nice book by Achyut Godbole that is called the Vitamins. Pellagra was once a time, Pellagra was fishing all the people. So many deaths with the Pellagra. That sour or musty bread odor. Scrofula. Now, scrofula is common in homeopathic metromedica. You come across so many times scrofula. Stale beer, old beer or bad beer, old, useless old beer got that typical odor like old beer. Scrofula. Swedish in diphtheria. Now, diphtheria nowadays is rare. So many metromedica is written about so many things about diphtheria. Diphtheria is rare nowadays. Then inborn errors of inborn errors of metabolism. Then urine, sweet sebum or serum, that's a wax, ear wax like odor to urine. What is the description of odor? Maple syrup or burnt sugar like urine. This syndrome is called the maple syrup urine disease. Urine musty, trisonemia, trisoanemia. Then urine smell like tomcat urine. Your cat urine like. This is a methyl crotoglycan This is a typical inborn error of metabolism. Other urine ammoniacal urinary infection, that is urea splitting bacteria. Example, Proteus species. So by smelling, you can find out that which type of UTI is there. Urinary infection of nitric acid. Remember nitric acid, benzoic acid. All these are used for this kind of UTI caused by Proteus species. Urine medicinal, penicillin and its derivatives. Urine or vomitus, violet odor. Then this is turpentine poisoning. Skin, foul or unpleasant. Skin diseases with protein breakdown. That is the pemphigus. Then hydrantis suppuratica. Vomitus, garlic, arsenic or phosphorus poisoning. Stool, villi, that is unpleasant or foul odor. This is a malabsorption syndrome. Maybe celiac disease, maybe cystic fibrosis. Rancid stool, shigellosis. Shigella, you know the shigellosis. Foul vaginitis. Now, vaginal odor, foul. Vaginitis, foreign body, slugging, fibroid, or malignancy. Now, foul vaginal odor, many times it is a malignancy, uterine malignancy. Semen, case of rape. Nauseating sweet, that is gas gangrene, and feces, proteolytic bacteria. So, clinical relevance, historically, Galen and all those, they use this. Now, concept of electronic nose. Physicians' natural nose, we are trying to develop it. Breath-based cancer detection. Now, what the research is going on? Breath-based cancer detection, diagnosis of tuberculosis on breath, monitoring metabolic disease, non-invasive screening, and early warning. Even some dogs are trained to diagnose the cancer. Like their bomb squad. Now, after a few days, there could be a dog in a doctor's clinic. Now, send the dog on a patient and he can diagnose the cancer. This is also a possible thing. Advantages: non-invasive, instantaneous, useful in resource-limited bedside settings, can provide early clinical clues. Conclusion: physician knows is an ancient yet relevant diagnostic. Metabolic, toxic, infectious, suicide. Traditionally, olfactory observation and modern biosensor can give us a state-of-the-art diagnostic tools. I want to show you what the Metra Medica says about. Just if you search in a repertory about Metra Medica, okay. Now there are so many rubrics. I hope you people have got repertory. Now from mouth, offensive odor, 377 repertory. Now offensive, you can diagnose and you can understand what you are actually treating. Then then offensive odor, female genitalia, offensive odor. Now this all 200 are remedies useful for female cancer, slugging, fibroid, female or basically uterine, intrauterine malignancies. Then odor strong generalities, then offensive foul putrid mouth odor. Now, I hope you can understand the clinical science, how homeopathy is related with the clinical science. Many times, as per my 25 years of experience, I will tell you that our Metra Medica is rich in ICU symptom. Because when the Metra Medica was written, there was allopathy was not developed. And the patient was with homeopath till the death, till the death. So our many symptoms we are actually not using in our OBTs nowadays, but because these are the symptoms or these are the remedies which you have to use in ICU. So many remedies are there, perspiration, offensive, and all those things. Anyway, I hope so. You understand my point that your nose, you can, if you use intelligently, it can help you in homeopathic practice. So this is the way, if you want to practice homeopathy in a proper way, you can understand the rubric, their significance, their clinical importance, and by using your all the senses, taste and smell, we got such abundant information from patient. uh, I hope enough from my side. I had taken 45 minutes already. I think I will like to have some question and answer, so if we can discuss what the things, if you have any queries.
Okay, thank you, sir. And participants, if you have any questions, please raise your hands and ask question to Dr. Santosh. Please.
Actually, I was suffering from upper respiratory tract infection and I was much worried whether I'm able to take the lecture or not. I'm getting a bad throat pain, but still, you people are so good that, and with the God's grace and with homeopathic brahmania, I was able to take the lecture. I'm really sorry for that. That's why I have many more things to tell you, but now I'm getting fatigue in my larynx. You can ask the question. We can have some discussions also. I hope you people understand something.
This is iPhone. Okay, please unmute yourself and ask. Okay.
Sir, good evening, sir. I'm Dr. Sushrut. I'm calling from Hubli, Karnataka. Sir,
Okay.
what is your view on olfactory route as far as homeopathy medicines are concerned? Because you are very well versed with the smell part of it and pheromones and all that. So,
Yeah.
what is your view on olfactory route of homeopathic medicines?
Okay. Nice question, sir. I'm fortunate that I got so many friends from modern medicine. So many times I got a call from the different ICUs and hospitals. The patient on a ventilator and on a deathbed, and patient is on a ventilator. Can you do something for that? And that so many times I had used this olfactory route, and they physicians is very happy. You are giving only smell. You are not actually introducing any medicine. So there is a no question of the legal issues and all those. So many times I am famous in our city for giving me treatment to the ICUs on ventilator patient, especially at the time of COVID. I had used abundantly Ferrompos. My lecture is there on your YouTube channel also on Ferrompos. We had worked so nicely. It works so fantastic. I think it's an excellent route to go for going for the homeopathic part of you. Nice question, and I'm telling you, it had given lots of success to me, and I'm requesting all of you that please try that. That might give you a good success also. Actually, I will tell you one more thing. I want to bring a wiseness of Dr. Hahnemann. Now, the sorbitrate, the tablet sorbitrate, where you keep sublingual. Why we keep the sorbitrate sublingual? Because the sublingual vein directly drain into the superior vena cava, directly drain into superior vena cava. So when you want to urgent drug delivery, rapid drug delivery, neither injection, not intramuscular, neither IV, the fastest route is keeping the tablet sublingually, because sublingual vein drain into superior vena cava. So you are bypassing the portal circulation and directly entering into systemic circulation. We used to treat the vitamin B12. Now there's that Neurokind OD, oral dispersible vitamin D, Neurokind OD, that brand. I used to keep it sublingually and it gives fantastic result. Now here the wiseness of Dr. Henneman. He had selected the sublingual route. Means he is aware that the sublingual is the fastest route of absorption. And in future, whenever there will be the physics or chemistry develop, and we understand the basic molecular basis of homeopathy, definitely this sublingual route has to do something over there. And as well as the nasal vein, nasal area, the venous drainage is also directly into the superior vena cava. So if you want to give urgent on the rapid drug delivery, give sublingually or give nasal spray. B12, vitamin B12 nasal spray are also there. So this is the fastest drug delivery route which homeopathy is taking. So olfaction and sublingual are excellent route, and that's why modern medicine start using, realizing it, and start using like sorbitrate on so many drugs. Okay, thank you. Any question?
Thank you, doctor from, I don't remember the name. Doctor,
Santosh.
have you? No, not your name, sir.
Yeah, I'm not yet done. I have one more question to sir.
Okay, you can ask.
Please.
Sir, what do you think if you say that it's very near to carotid artery, or if it is near to vasculation as far as the the route is concerned? So do you think homeopathy works with the dynamic principles or as a physical element? So if it is a dynamic
I don't tell
principle,
that
then why do you
carotid,
need
not
a
carotid.
nearest to?
No.
No, any vasculature
Pardon.
for that matter.
I will give you
question
explanation. So sublingual vein is directly the draining into superior vena cava.
No,
Now
I got your
I
point.
understand your question. Materialistically, homeopathy is working materialistically and dynamically. See, there is one my presentation on YouTube also there. There where I see how homeopathy works. Really, nobody knows. But our physiology or medicine is full of nobody knows type of questions. Even physics, physics, there are so many things in physics and chemistry, that Higgs boson or matter, antimatter, white matter, dark matter, and all this chemistry and physics. So how homeopathy work? What the real meaning of dynamism? Is it is a material which is a subatomic particle? Is it something that is a subatomic particle or something less than that which is working in a form of homeopathy? We don't know. So this is a debatable question. So homeopathy, I think in the next 500 years, physics and chemistry can solve this mystery. So how it work? It work dynamically or it work materialistically? We really don't know. What today we call dynamic, because we don't know the subatomic particle, because we don't know the Higgs boson structure, because we don't know the matter and antimatter, the physics and chemistry failing to know how homeopathy works. So this is the problem of physics and chemistry, not the homeopath. So as an homeopath, we don't know. So you can say that homeopathy work dynamically, okay, homeopathy work materially, okay, somehow. But why Hahnemann selected the sublingual route or nasal route, like olfaction route? If possible, some subatomic particle is there in a potentized medicine, it is working through that route. I hope I give an answer.
Thank you, Dr. Santosh. And we have question in the chat box. Can we diagnose genetic disease by examining saliva?
Yeah, definitely. Nowadays, so many genetic testings are there examining the saliva. The idea comes from the way I told about that the kissing is actually genetic sharing. That was a primitive way of nature to select the good gene to pass away. Now, definitely saliva is a sample where you can do the genetic testing. Any body fluid, not only saliva, any body fluid got our genetic hallmarks are there. Any body fluid, blood, saliva, semen, you can use anything.
Okay, thank you, doctor. And this question is from Anjali Patel. Anjali Patel, if you want to ask directly, you can unmute yourself and ask. I think you got the answer. Okay. Okay, anyone else? Dr. Ram Parvesh Shah. I think there is.
Hopefully, you people understand something or mostly nothing. No more questions.
No, mostly it is like that. Not more questions. We are not getting much questions after many sessions. Not because of understanding, not depend upon that. It is the habit. I think so. Anyway, there is no questions here.
Okay. I want few more things. If there are no questions, I can
We have
share
only
with you.
5 minutes. 5 minutes you
5
can
minutes. Yeah, I can share you some handouts also. Just to give me 1 second.
with that 5 minutes.
Within 5 minutes. Yeah.
You can take little more time.
Uh,
You are already took your 5 minutes.
this is one safety guide. While if you get any vomitus having bitter almond test, what the point you should handle with precaution, with how much precaution you should be there, you should take care of you and your staff also. This is so dangerous to handle the bitter almond odor having vomitus having bitter almond odor, because this is the cyanide case of cyanide poisoning. You can, so I will share with this Dr. Dhanesh, so he can share if anybody needs it. You can even contact me. I can share you. So how to handle, these are the precautions you have to take care. So always there is a possibility of cyanide poisoning if there is a that typical odor. This is what one handout I want to show with you. Then the next point I want to show you, some new techniques are coming in the field of this olfaction, and hopefully uh, ho- hopefully it can work, it can work in a future, like by that chemistry, that analytical chemistry. As somebody want my mobile number, my number is a 9422. If you want to my number is a 9422 424650. My number is a 9422 424650. So modern techniques are coming, and so many things are coming in, even in field of homeopathy. AI is going to change so many things. I hope it's almost 9:27. You can conclude last 3 minutes. Any
Doctor,
question is there in chat box?
no, sir, it's appreciation.
Okay, I will put my mobile number over there.
Yeah, we have already your mobile number is already in the link, I think.
Okay, better. Okay, thank you.
It is better to put here also. I think the message is from iPhone, Dr. Shushruth. He only asked questions before, I think.
Okay.
He actually, I have number, so trying to get organized or contacted. Okay. Okay, I will send you the number of Dr. Danesh. Anyway, thank you so much, sir. Actually, it is a different subject regarding orders. And I think nowadays it is very difficult to identify the order, because everyone is using deodorants. So we couldn't find out the exact order of a person. But even though, as you said, we can differentiate from the, even they use perfume also, we can differentiate. Anyway, it was a wonderful selection. Dr. Ram Parvesha sir came, and I'm inviting you, sir, for to give vote of thanks to Dr. SANTOSH MADHAV. You're welcome.
Thank you. Thank you, Dr. Anjali. And congratulations, Dr. SANTOSH MADHAV.
Thank you, sir.
Very nice, excellent session. Odor and a smell, detail described. Odor and a smell. So, the subject is the very difficult. So
Subject
very
selection
well
is
self-selection.
very
Very
intelligent question, right?
very thanks, IFPH, behalf of IFPH, thank you. And again, presentation, very thanks, Santosh. Thank you.
Thank you so much, sir. Even though you are suffering with throat infection, you taken the classes very nicely. Even I didn't felt that you are feeling sick, but I think because of your interest. Thank you so much. Come again. Thank you.
हाँ?
Now we are moving to the
ये
Malayalam.
होम्योपैथिक दवाई है.
Thank you. Thank you. Good night. Bye bye, everyone. Now we are moving to Malayalam session. I am inviting Dr. Shaila for moderating Malayalam session. You are welcome. And Dr. Danesh, please notice here.
Yes.
Dr. Shushud has sent message. He have to discuss something with the organizers. So please put your number here.
Okay.
Or contact him. Thank you. And Dr. Shaila, you are welcome.